Hello and good evening to you all. I'm your host and moderator, Preeta Harikrishnan, Deputy Manager Admissions, Amrita Health Sciences Kochi campus. Thank you all for joining us today as we present to you a talk on the scope of dialysis therapy as an allied health course. I'm sure you will benefit a lot from this topic, and to make sure we are helping you the best, we have the chat box wherein you can send your doubts, and your doubts would be cleared at the end by the end of the session. So without any further delay, let me introduce you to our special guest today, Dr. Shabari Haridas, Senior Resident, Department of Nephrology, Amrita Institute of Medical Science, Kochi. Doctor completed his MBBS degree from Pushpagiri Institute of Medical Science and Research Center, Tiruvalla, and MD in General Medicine from Jubilee Mission Medical College and Research Center, Thrissur. He has also attained a postgraduate diploma in diabetology. Dr. Shabari has got a lot of exposure to various super specialty cases, including cardiology, neurology, nephrology, and gastroenterology. He regularly attends and presents various cases in seminars, conferences, clinical meets, and research meets. I welcome you, Doctor, to share with us your presentation and expecting your talk to motivate our students. Welcome, Doctor.
Good evening, ma'am. Am I audible?
Yes, yes.
Okay, I hope the screen sharing is enabled.
Yes, yes, it's okay now.
Can screen is visible, no, ma'am?
Stop. Yes, I can see. But how is it for you? Stop.
Screen sharing is.
Please enable the slideshow, sir.
Is it visible now?
Yes, it is visible.
Can you see the first slide?
Yes, wherein it has your name.
Yeah.
Yeah.
Can I start now, ma'am?
Yes, yes.
Okay. So I'm Dr. Shabri Ardas, and I'm very thankful to Amrita Institute for giving this opportunity to talk to you guys. So, as you all know, we'll be discussing about dialysis therapy today. So before going to the topic, the main highlights for today is one is there will be a brief introduction what is dialysis and all, and what is the role of dialysis therapist here, and the curriculum of the course, what is the scope we have, and how the exact course is conducted at Amrita. So we all know that when we hear about dialysis, we know that we are doing it when the kidneys are getting failed. So kidneys are a pair of most sophisticated filters that is given by the God. It has got a very structured and divine engineering. And the main functions of the kidneys is one is purification. Will remove the excess fluid, and it will maintain the electrolytes in the body, and also it has got very other functions like maintaining the acid base. It creates a formation of hormones to maintain the level of hemoglobin in the blood. So there are different conditions, especially mainly diabetes in India. The burden of diabetes is very huge. Almost 30 to 40% case of chronic kidney disease is to diabetes. So as a result of this disease, the kidneys will go for a failure, and to continue our life, we have to depend on the dialysis. So, so what is dialysis? It's a very, to simplify, we are taking the blood from the patient's body, and we will filter it, and we will the purified blood will be returned back to the human body. So that is the most simplified definition of dialysis. So dialysis, we call it hemodialysis, and the word meaning is that hemo means blood, dia is a Greek term, lysis means separation. So dia means split. So we are basically splitting and filtering the blood. That is the word meaning of dialysis. So it is done when the kidneys fail, or kidneys will get damaged. So there are two main conditions where the kidneys are getting failed. One is there is a temporary loss of function, or it can be a permanent loss of function. So what are the conditions which cause a temporary loss of function, especially the patient is having infection like leptospirosis, or a patient is having other conditions like snake bite. All these conditions, for the temporary support, we will dialyze a patient for like 2 weeks or 3 weeks, depends on the recovery of the condition. We have to support the patient with hemodialysis. And the second situation is the permanent loss of function, kidney function, that we commonly encounter. That's we have a chronic kidney disease. Chronic kidney disease means patients are having a kidney disease for a chronic period of time, like months, years. So for years, we have the patient will be telling, I have kidney disease since 2010. So now the creatinine is like 910. The patient will be having aerobic symptoms. Patient will be having fluid overload. Patient will be dyspnea. Dyspnea means breathing difficulty. Then we have to start on hemodialysis, and in that is a permanent loss of kidney function. Then the patient will have to be continued on lifelong hemodialysis. So dialysis is performed using a dialysis machine that you can see in the slide. So in the slide, we can see that the red line, that is, we will take the blood from the patient's body. It will be passed through the filter. You can see a cylinder-like structure that is attached to the machine. In fact, that is the artificial kidney. That is the most important structure of the dialysis machine. Okay, why it is called the most important structure? Because all the ender filtering and all of the process happening in that cylindrical part. So after that, the purified blood will be returned back to the human body. So there is a rising number of people with kidney failure, probably because of the increased burden of diabetes, hypertension, and all other conditions. The need for dialysis and the dialysis centers is increasing day by day. Altogether, there are more than 1.2 lakhs dialysis people are there in southern India itself. And for the survival of patients on dialysis, they are highly dependent on good quality of hemodialysis. So BSc dialysis therapy is basically an undergraduate program that is offered by the Amrita Center of Allied Health Sciences. So who is a dialysis therapist? He is a medical professional who administers dialysis procedures, and this course trains healthcare professionals in operating the dialysis machine, and they can encounter and interact with the dialysis patients. So there are two types of dialysis. One is the hemodialysis and one is the peritoneal dialysis. So these are technology and techniques in the dialysis process have evolved, opening many new options for those who require frequent dialysis procedures. So coming to the peritoneal dialysis means there is a peritoneal cavity in the inside our abdomen. So we'll be putting the dialysis fluid into the cavity, and we will remove the fluid from the cavity so that most of the nitrogenous waste products will be removed. So that is called peritoneal dialysis, and Amrita is one of such center where we start peritoneal dialysis, and we have a lot of patients who are on continuous peritoneal dialysis. So basically it's a life saving therapy, so thereby treating them, it is a kind of a social service also. So, what is the role of dialysis therapist in the dialysis unit? So, a dialysis technician can set up, evaluate, operate, and troubleshoot dialysis machine. They are the primary caregiver of patients who are undergoing any type of dialysis treatment at the center. They work in close proximity with the patient's doctors and the nurses at the hospital. And the technician is also trained to monitor the condition of the patient, including taking vitals like pulse, BP, and all other general conditions and other medical evaluation criteria. They should be well aware of all the procedures like cannulation of the fistula, which will be discussed later, so that they can quickly respond to any kind of complications occurring during the procedures or any other emergencies. To note that the dialysis patient is surrounded by a dialysis therapist, nurse, and a nephrologist. So in our dialysis unit, there are three groups of people. So they'll be well versed with managing and sterilizing of the dialysis machine, monitoring patients and ensuring their needs and requirements, administering medicines during dialysis, teamwork with nurses and doctors, preparing for emergency scenarios, training staff for administering dialysis, and they have a very important role in informing the patients on aftercare, healthcare, and dietary management. So, coming to the curriculum of the course, this is basically a 4-year course where the first there will be a 3-year course, and after passing the final year, that the third year, there will be a 1 year of internship. That constitutes the BSc dialysis therapy, and also we have a MSc dialysis therapy that is a 2-year course. So the course include we'll be dealing with all the fundamentals of kidneys, various kidney diseases, working and setting up of dialysis machines, patient care, and this is conducted in association with the development of nephrology, where we have a very senior nephrologist who have more than 20-25 years of practice in the medical field. And coming to the each year, in the first year, we will be dealing with anatomy, physiology, biochemistry, microbiology, and all the basis of computers and how we can comprehend with the patient. And in the second year, we will deal with pharmacology, pathology, applied basic sciences, and clinical nephrology. Third year, we'll be dealing with dialysis therapy, complications, and equipment. And fourth year is the year of internship. So they'll also deal with the patient information collection, working environment. A good working environment will be provided, and procedure recording on the medical chart, and patient and equipment monitoring will be there, and the classification, segregation, and all the collection of waste and patient care management will be well versed. So here in Amrita Institute, the practical sessions will start from the second year, which is unlike from all other centers where you will get a practical session, or you can encounter with the patient only in the internship. So there will be seasonal, sessional, as well as final year exams during each year, and the students will be evaluated for both their theoretical and practical knowledge. They will have to maintain a project book and a log book, and the internship period will spend in the dialysis department to gain practical experience and to get adapted to the work atmosphere. So, what is the scope of the dialysis therapy? So, once you are graduated from the course, you can work as a dialysis technologist in all leading multi-specialty hospitals in the country as well as in foreign countries. They can work in both Kerala government and central government hospitals. They can also pursue their career with master programs in the same and get into the teaching profession of graduate students. They can also find work in quality control and other areas in dialysis machine manufacturing. So here at Amarda, which is one of the top reputed universities, which is NAC accredited, and the fifth best university in the National Institute of Ranking Framework 2022. There, it will be a well-structured course. We have a specific emphasis on the practical knowledge. You will be dealing with all the manipulation of complicated scenarios. So when we talk about the complicated scenarios, you don't have to worry about that because you will be surrounded by very experienced seniors. There will be nurses and including doctors. So once the course is completed, you have that much of exposure that you will be very well versed with how to manage all the complications. And also you will have exposure to all the advanced specialized procedures like peritoneal dialysis as explained, hemodiafiltration, and continuous renal replacement therapy, that is the CRRT, plasmapheresis, that is the removal of blood from the plasma. And we also have double filtration plasmapheresis, that is one of the only machine that is available in Kerala. And we have you will have exposure for sepsis extracorporeal therapies, where there are certain conditions where we can use this therapy to control sepsis. So we will use extra filters in spite of normal ones. Also, you will be exposed to absorption therapies where in the conditions like poisoning, snake bite, and all. So there won't be any limit in exposure. So hemodiafiltration, CRRT, and plasmapheresis will be encountered in the ICU settings, not in the dialysis unit. So you will get adequate training and documentation according to the NAC standards, and you will get opportunity to work under the supervision of very highly skilled medical professionals. So we have excellent infrastructure. There will be a central library And there will also be extracurricular activities, and hostel accommodation will be provided, including canteen. Thank you.
Thank you, Doctor. So is there anyone who has any doubts connected with this course? You could raise your hands or you could ask your doubts. You can drop it in the chat box also. So meanwhile, Doctor, we have Shanley from admissions who will be telling about the admission process this year in the dialysis therapy course.
Okay.
Shanley.
Yes, ma'am. So can you please stop sharing?
Yeah.
Good evening, one and all. I'm Shanley from Admission Office Kochi. I'm here to explain the admission process for the 2024 academic year. So in Amrita, we have various BSc Allied Health Science courses. Around 17 courses are there. One among that is BSc Dialysis Therapy. So coming to the fee structure, we have three categories: scholarship category, non-scholarship category, NRI category. And the tuition fee for scholarship category is 1,50,000. For the non-scholarship, it is 2 lakh. And for NRI category, it is $4,500. And another fees of rupees 38,450 is chargeable. All these fee structure mentioned in the screen is the first year fee structure. And hostel and mess fee is around 68,000 per year. As said, the duration of course is 3 years plus 1 year compulsory internship. The eligibility will be minimum 17 years of age and maximum 23 years of age on or before 31st December 2024. The student should acquire a minimum of 60% aggregate marks in physics, chemistry, biology, and English in their plus 2 examination. So regarding the entrance examination details, we have finalized the entrance examination date. It will be on May 18th and 19th. The student can opt either one date among these. And we have three time slots. Slot 1 from 9 a.m. to 11 a.m., slot 2 from 12 p.m. to 2 p.m., and slot 3 from 3 p.m. to 5 p.m. The facility to book your slot and date will be shortly available in your application portal. So you can continuously, frequently check your portal. That is applyug.amrita.edu. At the same time, you have to check your registered mail ID. So the question paper pattern will be physics, chemistry, biology, English. 25 questions each from physics, chemistry, biology, and 5 questions from English. The total marks will be out of 240 and the duration will be 2 hours with 80 questions. So for each correct answers, 3 marks will be awarded and -1 will be deducted for each wrong answer. So BSc Biotechnology, Microbiology, Pharmacy courses, you have two options. Either you can attend entrance examination or you can secure admission using the higher secondary examination. But with the criteria that if at all you have biology in your plus 2 subject, you have to attend entrance examination. The students, those who don't have biology in their plus 2 can secure admission using HSC mode. The detailed information handbook and the syllabus for the examination is updated in the given website. It is amrita.edu/admissions/AEEL. Just check the website. All the detailed explanation is given. So you have to strictly check the website. Okay. So once after booking your slot through the Amrita registration portal, your admit card will be available from the next day onwards. So the notification will be given to you through your registered email ID and through your registered mobile number. So candidates are required to appear at the center allotted to them as per the date and time chosen by the candidate for attending the test. So regarding the results of AEL, candidate will be able to access their results by entering the login details in their application portal. So just take a note down of these website displayed. It is www.amrita.edu/admissions, the main page of Amrita, and also the entrance examination website, and also the portal. This applyug.amrita.edu is the only portal other than BTech course offered in Amrita. So regarding the registration details, many of you have already registered, and those who have not registered, this is the portal for the registration. We have step one, that is the registration process by entering your mail ID and mobile number. And in step 2, you have to enter your personal informations. And after entering the personal information, you will be asked regarding the city preferences. Since the examination is based on computer, it is a computer based test. You have to select 3 options which is nearby your home. And in the next step, you can select the campus and the courses which you want and just click the apply now button. After that, when you go to the my application tab, you can just see the exam centers you have preferred and the courses also you have preferred. And coming on to the next step, it is the application fee payment, which is of rupees 550 for the Amrita entrance examination, life sciences, which is the common entrance exam for BSc nursing, pharmacy and allied health sciences courses. And in the next step, you have to enter your academic details. If you're waiting for the +2 results, just you can opt an option awaiting. And in the document upload session, just upload the documents which are currently available with you. Later on, when the +2 results are published, upload those documents later. So after completing all the stages of registration, the candidate will receive a confirmation mail including your registration number. Save your registration number, registered email ID and password for the future references till the time of your admission. And the last date to apply for the BSc Nursing, Pharmacy and Allied Health program is on May 13, 2024. So if at all you have any admission related query, you can use the given contact details. Please note down the numbers, or else you can mail us to ugadmissions@aims.amrita.edu. These numbers and mail ID, it is displayed in the Amrita BSc Allied Health Science page. The Amrita Vishwa Vidyapeetham has not appointed any agent or third-party client for securing admission in any program. Students are hereby requested to contact only the given numbers in the website for any admission-related queries. Thank you.
Thank you, Shanley. But there is one question raised by Abhishek who wants you to repeat about the admit card.
The slot booking option will be available approximately from May 15th onwards. So once if you book the slot, like maybe around 15th and 16th, if you have option to book your slot, the next day, May 17th, you will be able to download your admit card. So just check your mail and the portal regularly. Okay. Thank you, ma'am.
Abhishek, is it clear to you? Doctor, there is one question by one of the attendees, like what is the salary range they could expect after completion of this course?
So that will depends on where you join and depends on the interview and the examination you'll go through, especially. But the exact amount I cannot comment. It depends on center to center.
Okay. Do our students have chance to join Amrita itself after the course?
Yes, definitely. But there will be separate the interviews for that, and after that, if it is cleared, they can join here itself.
Okay, see that's again a hope for the candidates who join Amrita, because they also have a chance to be taken up here itself once you prove you are being the best. So I'm so happy, Doctor, for giving us such a lot of information on this particular course and
Thank you.
why these candidates should really join Amrita with such good faculty and such sincerely hardworking doctors like you who are there for being with them to share with us such a lot of motivation. So candidates, I think you should be now getting yourself ready for that. We have the entrance exam, as Shanley was telling you, it is on the 18th and 19th. You could choose any one of those days and based on the time slot that you choose. I think there is again another question. Anakha, you should be gaining 60% minimum in the subjects biology, physics, chemistry, and English together, aggregate of that, not separately for each of them. Any other questions? Abhishek has again another doubt. What is the website to download admit card? You have to, Shanli.
Yes, Abhishek, you have to log in to your registration portal. It is applyug.amrita.edu. So whatever information or update regarding the entrance examination will be given through your mail and your portal. Thank you.
Okay, is that clear? Any others attendees who have any doubts to ask doctor?
Ma'am, let me add one more thing
Okay.
regarding before concluding the session. So regarding Amrita, the fascinating thing I felt is that the degree of exposure you are getting here is really immense. So basically, the Amrita Institute is actually a referral center. You will be seeing patients from Kasaragod to Kanyakumari. Even from outside the states, we'll be seeing patients. So there won't be any complication extreme more than this that you will come across in the course. So the importance is that when you join the when somewhere else after finishing the course here, the degree of confidence you will be having, that is actually something. Hello.
Yes, you can continue, doctor.
Yeah. Because you will be confident enough to deal all kinds of emergencies. Because personally, I can say because if there is any emergency in our dialysis center, we hardly get any call. We will be informed like we there was this kind of complication has had happened, and we managed it. So the dialysis therapist itself could manage most of the complications. That how good these our dialysis therapists are. Second thing is that the equipments, the advanced already explained, like hemodiafiltration, CRRT, plasmapheresis, which is rarely available in all other centers. Only few centers have all these things. So these are the two things which I want to add before concluding session. And one more thing is that in the 3-year course, you will be getting a practical exposure from the second year, which is unlike the from other centers. In other centers, you will once the third year is finished, only during the internship period you will be seeing and you will come across all these patients. So, but here after the first year itself, you will be well versed with all these patients. We will be seeing the machines. You can manage everything. You have the freedom to do everything. Very good supportive, very senior technicians here, like senior in the sense more than 20 years. That is that's kind of vast experience these therapists have. So that is something I really wanted to add before concluding the session, ma'am.
That's
That's
very
it.
nice.
Yeah.
That's very nice. Thank you, doctor, for
Yeah.
that.
Okay.
Abhishek, do you have another question?
Um, Yes, ma'am.
Yes.
Ma'am, there is a doubt that what is the documents required to register for another candidate?
You have to, Shanley, could you answer that? He wants
You
someone else to join, yeah, register.
Yeah, okay. So if you want to register, just visit the link applyug.amrita.edu. So there the candidate can register using their individual mail ID and mobile number. And the documents is like you want to upload your 10th certificate, your Aadhaar card, your birth certificate as of now to register. Okay. And later on, you can upload your transfer certificate, migration, character and conduct, then +2 certificate. Thank you.
Ma'am, can we use BTech certificate?
Sorry, I didn't get you.
Can we use BTech certificate instead of HSC certificate?
What certificate is that?
10th +2 certificate. Instead of 10th +2 certificate, we can use BTech certificate or not?
We need the 10th +2 certificate.
Yes.
Yes, we need that.
Okay.
But you have time to upload now.
Yes.
For attending the entrance examination, no need to upload. But after that, once your entrance rank is displayed, and in order to get seat, we have to check your percentage of marks. For that, you want to upload your certificate. But after the entrance, you can upload. Okay.
Ma'am, another question is that I have only done BTech on not plus two.
B.Tech, you mean?
Yes.
But for this course, we need plus those candidates who have studied +2 with biology, physics, and chemistry. That is a must.
Uh,
Yeah.
Sorry, ma'am, but I have done BTech but I have done plus two first year, but not plus two second year.
No, I don't think that is possible. Anyway, you could just send a mail to ugadmissions@amrita.edu and then we could look into it. Okay. As for
Okay,
now,
ma'am.
+2 with biology, physics, chemistry is a must.
Ma'am, you can message me the website name, please.
Yes, it's given the chat box. Please look into it.
Okay, ma'am.
Okay, thank you, Abhishek. Krishna
Yeah, ma'am.
Mugundan. Krishna Mugundan. I think you had a doubt. Krishna Mugundan.
Yes, ma'am.
Yes, you could ask your doubt.
When will classes start?
Pardon? Yes, you could ask your
When
doubt.
will classes start?
Classes approximately it will commence from the month of August onwards.
Thank you, ma'am.
Okay. So any other doubts from the attendees? Or then we could wind up the session. So I hope most of you, is there any other question? I see one question raised. Okay. So I'm so glad and grateful actually, doctor, for you having spending this much of time with us.
Thank you.
I also thank all the attendees who have attended this session. And I think the sincere efforts of Dr. Shabari Haridas have been valuable to you. And I am thankful to each one of you for attending this session. So I think it's time we could wind up this webinar for now. Thank you.
Thank you.